You're sitting at home, the room quiet. Maybe the TV murmuring in the background. Then it hits. A crushing pressure spreads across your chest like a heavy weight you can't push away. Your breathing turns shallow. Your jaw tightens. One arm feels weak, almost foreign, like it doesn't belong to you anymore. You look around the room and realize something terrifying. You're alone. No one to call out to. No one to notice what's happening except you. Every single year, hundreds of thousands of people suffer heart attacks at home, and a massive number of them are adults over 60 who are completely alone when the first symptoms begin. Here's what most people never hear. Nearly half of fatal heart attacks happen within the first hour, not because medicine can't help, but because the wrong actions are taken, or the right ones aren't taken fast enough. Most seniors are never taught what to do in those first critical minutes. In fact, many people instinctively do things that actually increase heart damage and reduce survival. In the next few minutes, I'm going to show you 7 immediate actions that can dramatically increase your chances of surviving a heart attack if you're over 60 and alone. These steps are backed by emergency medicine research, cardiology guidelines, and findings from the American Heart Association, Harvard Medical School, and major hospital systems that study what truly saves lives before paramedics arrive. And stay with me until the end, because the number 1 action is the most misunderstood of all. It's not lying down. It's not waiting it out. And it's not what most people instinctively believe will help. Before we continue, comment your age and where you're watching from. It helps other seniors realize they're not alone, and helps this message reach the people who need it most. Now, let's go step by step, calmly and clearly. Number 7. Call emergency help immediately. This sounds obvious. Call emergency services. But here's what most people get wrong. They wait. They try to make sure it's really a heart attack. They downplay the pain, telling themselves it's indigestion, stress, or something that will pass if they just sit quietly for a few minutes. Inside your body, a blocked artery is starving your heart of oxygen. Every single minute of delay means more heart muscle is being permanently damaged. This damage doesn't announce itself loudly. It happens silently, cell by cell, while you're deciding whether to make the call. Studies published in the journal Circulation show that calling emergency services within the first 5 minutes significantly improves survival and long-term heart function, even compared to calling just 10 or 15 minutes later. You call immediately. You stay on the line. You say clearly that you are over 60, alone, and experiencing chest pressure, breathing difficulty, sweating, nausea, or arm, jaw, or back pain. You put the phone on speaker so your hands are free, and you follow instructions exactly as given. The most common mistake is calling a family member first, hoping they'll come over quickly. Another is trying to drive yourself, which risks collapse before you arrive. Keep your phone charged, keep it within reach at all times, and make sure emergency numbers are easy to dial without searching. This one action starts the rescue clock, and the next step protects your heart while help is coming. Number 6. Sit upright. Do not lie flat. When pain hits, many people lie down instinctively. Unfortunately, this can make breathing more difficult and increase stress on the heart. Lying flat allows blood to pool in the lungs, increasing shortness of breath and oxygen deprivation. Sitting upright reduces venous return to the heart, lowering workload and easing pressure. Hospital cardiac monitoring data shows patients who remain upright during acute cardiac distress often maintain better oxygen levels and experience less respiratory compromise. Sit in a sturdy chair or on the edge of your bed. Support your back. Keep both feet flat on the floor. Loosen belts, collars, or tight clothing around your chest and waist. A frequent mistake is pacing the room in panic, which spikes heart rate and oxygen demand. Another is fully reclining to relax. Choose a chair near your phone and front door if possible. If you feel lightheaded, lean back slightly, but do not lie down. What many seniors don't realize is that posture directly affects how hard the heart has to pump during an emergency. Even a small change in position can shift pressure inside the chest. Sitting upright also makes it easier for you to breathe slowly and clearly, which helps prevent panic-driven surges in blood pressure. If you use supplemental oxygen or inhalers for lung conditions, being upright allows them to work more effectively. Avoid slumping forward sharply, which can compress the chest. Think tall but supported. This position gives your heart a mechanical advantage, and the next step helps prevent the blockage from worsening. Number 5. Chew aspirin if safe for you. Aspirin is one of the very few actions you can take at home that has been shown, again and again, to influence survival during a heart attack, but only if it's used correctly and early. Most heart attacks begin when a plaque inside a coronary artery ruptures and triggers rapid clot formation. That clot acts like a cork, blocking oxygen-rich blood from reaching heart muscle. Aspirin doesn't dissolve the clot, but it slows its growth by preventing platelets from clumping together. That slowing effect can mean the difference between partial damage and massive, irreversible injury. The American Heart Association has repeatedly emphasized that early aspirin use, before hospital arrival, is linked to lower death rates when no contraindications exist. Timing matters. The earlier it's taken, the more heart muscle may be preserved. You chew 1 regular-strength, non-enteric-coated aspirin, usually 325 milligrams. Chewing is critical because it allows the medication to enter the bloodstream faster through the lining of the mouth. Swallowing it whole delays absorption at the exact moment speed matters most. Common mistakes include taking enteric-coated aspirin, which dissolves too slowly, or skipping aspirin out of fear without a medical reason. Others mistakenly take multiple tablets, which increases bleeding risk without added benefit. Do not take aspirin if you have a known allergy, active internal bleeding, or if your doctor has clearly instructed you to avoid it. Keep aspirin where you can reach it quickly, even in low light or under stress. Replace it before expiration. This single, simple action can slow the cascade of damage. And the next step focuses on calming the body systems that can silently make things worse. If this step just opened your eyes, take a moment to like this video. When you hit like, you're not just supporting this channel, you're helping this life-saving information reach other seniors who may be alone one day and need these steps just as much as you do. A simple click can quietly protect someone else over 60 who hasn't heard this yet. Number 4. Control your breathing. Fear triggers a powerful stress response. During a heart attack, that response becomes harmful. When the brain senses danger, it releases adrenaline and cortisol. These hormones force the heart to beat faster and harder, tighten blood vessels, and raise blood pressure. In a healthy situation, that response helps you escape danger. During a heart attack, it does the opposite. It increases oxygen demand at the exact moment your heart is struggling to get oxygen at all. Clinical studies in cardiac rehabilitation and emergency medicine show that slow, controlled breathing reduces activation of the sympathetic nervous system and helps stabilize heart rhythm and blood pressure during acute cardiac stress. Breathe in slowly through your nose for 4 seconds. Let the air fill your belly, not just your chest. Pause gently for a moment. Then exhale through your mouth for 6 seconds, as if you're slowly fogging a mirror. Repeat this rhythm steadily. Many people unknowingly hyperventilate, hold their breath from fear, or gasp for air. These patterns lower carbon dioxide levels in the blood, which can worsen dizziness, chest tightness, and panic. If you practice this breathing when you're calm, your body will recognize it under stress. Familiar breathing patterns are easier to access when fear takes over. This technique does not stop a heart attack, but it can slow its progression, reduce unnecessary strain on the heart, and keep you conscious and communicative until help arrives. And the next step ensures responders can act without delay. If this information feels important, please share this video with someone you care about. Many heart emergencies don't happen in public, they happen at home, alone. By sharing this, you could be giving a spouse, a friend, or another senior the exact knowledge they'd need in a critical moment. Sometimes sharing a video is the simplest way to help save a life. Number 3. Prepare critical medical information. During cardiac events, confusion, memory gaps, and slowed thinking are extremely common, especially in adults over 60. Oxygen levels may already be dropping, and stress hormones can impair clear speech. In those moments, even information you know well can suddenly feel hard to recall. That's why preparation matters. Emergency response research consistently shows that when paramedics immediately know a patient's medications, allergies, and medical conditions, treatment decisions are faster, safer, and more precise. Minutes are not wasted guessing, double-checking, or withholding medications due to uncertainty. If you're able, clearly state or write down your current medications, dosages, allergies, history of heart disease, stents, pacemakers, blood thinners, or diabetes. Say it slowly and repeat it to the dispatcher so it's logged before responders arrive. If you can place the information on a table or tape it to a door, do so. A very common mistake is assuming paramedics will figure it out once they arrive. In reality, unclear information can delay pain relief, clot-busting drugs, or critical interventions. Keeping a simple medical information card near your phone, refrigerator, or wallet dramatically reduces this risk. This preparation doesn't feel dramatic, but it can quietly save your life by removing uncertainty at the worst possible moment. If you want clear, honest guidance about staying healthy and independent after 60, subscribe to Senior Health Support. Every week, this channel shares practical, research-backed advice designed specifically for seniors, so you can spot problems earlier, act smarter, and protect your health before small issues turn into emergencies. Subscribing means you're choosing to stay informed, prepared, and in control of your health. Number 2. Do not sleep or wait it out. Denial is one of the strongest and most dangerous reactions during a heart attack, especially among seniors who have spent a lifetime pushing through discomfort and not wanting to cause trouble. Many people tell themselves the pain will fade, that it's probably indigestion, muscle strain, or stress, and that a short rest will make everything better. But heart attack symptoms almost never improve with sleep. In fact, lying down and drifting off can be deadly when you are alone. If you lose consciousness, there is no one to notice, no one to call for help, and no one to start life-saving care. What could have been treated becomes a silent emergency. Cardiology research consistently shows that delayed presentation to medical care leads to larger heart attacks, more permanent heart muscle damage, higher rates of heart failure, and significantly lower survival. Waiting doesn't just delay help, it changes the outcome. Staying awake allows you to monitor your symptoms, communicate changes to emergency services, and follow instructions in real time. Dispatchers may ask you questions repeatedly to assess your condition. If you are drifting in and out of sleep, that information is lost. A common mistake is telling yourself, "I'll just lie down for 5 minutes." Those 5 minutes often turn into dangerous delays. Another mistake is turning off lights and trying to get comfortable, which signals the body to relax when vigilance is critical. Remain seated upright. Keep your eyes open. Keep talking, even if your voice feels weak. If you feel drowsy, say so immediately to the dispatcher. Staying alert isn't about willpower, it's about survival. Every conscious minute buys time until trained help reaches you. Number 1. Unlock access and prepare for rescue. This is the step most people never think about, yet it has enormous impact on whether you live or die when a heart attack happens at home. Harvard Medical School-associated emergency medicine research shows that survival outside the hospital is strongly influenced by how quickly responders can physically reach the patient and begin treatment. Seconds matter, and locked doors, dark rooms, cluttered hallways, or confusion about where you are can cost those seconds. The moment you suspect a heart attack, unlock your door. If you have multiple locks, unlock them all. Turn on lights, especially near entrances and hallways. If you live in an apartment building, unlock the main door if possible, or clearly tell the dispatcher how responders can get in. If you have pets, Secure them so they don't interfere with entry. Sit in a visible, accessible place near the entrance if you can safely do so. Avoid bedrooms deep inside the home. Paramedics need space to work, to place equipment, and to move you quickly onto a stretcher. Do not shower to feel better. Do not lie down to rest. Do not take medications that were not specifically approved by a medical professional for heart attack use. Do not attempt folk remedies, stretching, or movement to walk it off. These actions delay care and increase risk. What many seniors don't realize is that emergency responders begin treating you the second they reach you, not after paperwork, not after questions. The faster they can get hands on you, the faster oxygen, medications, heart monitoring, and life-saving interventions begin. This step isn't about comfort or dignity. It's about removing every barrier between you and help. Preparing access is one of the most powerful survival decisions you can make while you still have control. These 7 actions don't replace medical care, and they are not meant to turn you into your own doctor. What they do is buy time, when time is everything. They slow damage, reduce chaos inside the body, and keep you stable long enough for trained professionals to take over. Heart attacks are not just about pain. They are about minutes, oxygen, and access. When these steps are done in the right order, they can mean the difference between a survivable event and a life-changing outcome. This is not about being fearless. It's about being prepared. Preparation turns panic into control, and control increases survival until medical help arrives. If this happened tonight, right where you are sitting now, would you truly know what to do first? Think about that for a moment. And if this information could protect someone you love, a spouse, a sibling, a friend, share it with them. In the comments, tell me which step you never realized mattered so much. Your experience could help another senior act in time. In this video, you discovered what to do when a heart emergency is already happening. The exact steps that can keep you alive when every minute matters. But here's the part most seniors never hear until it's too late. Heart problems often send quiet warning signs days or even weeks beforehand, and they don't always feel like chest pain. In the next video on this channel, Senior Health Alert: 3 Hidden Signs of Heart Problems, I reveal 3 subtle symptoms that many adults over 60 ignore because they seem harmless or unrelated. One of them shows up during normal daily activities and is frequently dismissed as just aging. By watching that video, you'll learn how to recognize these signs early, take action before an emergency begins, and potentially prevent yourself from ever needing the steps you learned today. Click on the next video now and give yourself the advantage of knowing before your heart has to scream for help.